Hey everyone, welcome back to the Dietitians and Nutrition Support. My name is Lauren and today we'll be talking through adult enteral nutrition formulas. These formulas we can classify into multiple different categories, and the categories will help us to understand what population would be best served through the use of these formulas. We won't discuss today any of the specific brands or companies that create these formulas, just due to the fact that you will probably encounter different formulary lists depending on your hospital, outpatient setting, or even just what your patient's insurance may cover for them. So we'll try and keep it broad today and talk through the categories, but if you have any specific questions, please feel free to leave them in the comments box below. So let's get talking about those adult enteral nutrition formulas. The first category of enteral formula that we'll talk about here today is the standard enteral formula. Within this category is your very basic formulas that have a normal distribution of protein, carbohydrates, and fats, and is meant for any patient that does not really show any strong malabsorptive issues. So this patient should be probably your average Joe. Nothing really crazy about this formula in general, but of course it is a standard, so it should work pretty well across the board unless your patient has any really distinct needs. These are also normally lactose-free and gluten-free, just as most all enteral formulas are. The next category of enteral formulas we'll see is the standard formula plus fiber. With this formula, it again is standard, the normal distribution of protein, carbohydrate, and fat, but it will have the addition of fiber. In most instances, you'll see that the fiber is enough to meet the daily needs for each of your patients, and that can assist them should they have any diarrhea or bowel movement irregularities. So if you're trying to help build up that gut flora and get their bowel health under control, then this can be a beneficial category to look to when you're providing for these patients. Our third category of enteral formulas for your adult patients would include a diabetic formula. This formula is made to be about 40% of the energy coming from carbohydrates. That's a little bit less than your standard formula and should be helpful for your patients to maintain healthy and stable blood sugar levels with avoidance of hyperglycemia. Our fourth category of enteral formulas for your adult patients is the renal formula. Renal formulas can be pretty distinct as opposed to some of our more regularly used formulas. This formula is likely going to see some limitations in terms of fluid content, sodium content, potassium, and phosphorus content. All of those pieces come into play depending on your individual patient's status in terms of their disease progression, whether or not it's acute or chronic. You may even see differences in terms of protein content in these formulas, and should you have a renal patient, you really need to think clearly as to what each formula that you can provide is, what that's going to do for them, how that's going to support their health and their healing. So because renal formulas can be pretty distinct and maybe a little challenging to use, you actually may even see some appropriate renal patients on a standard formula or another formula choice before they come to a renal formula, just because it isn't correct for them at that time. So renal formulas can be a great thing to use, but do keep in mind that they're not always perfect for every renal patient. Our next category of formulas is going to the semi or fully elemental formula. These formulas have been hydrolyzed so that some of the nutrients in them are broken down into smaller fragments that are more easily absorbed. If you have a patient that has malabsorption problems or maybe has some missing portions of their intestinal tract just due to surgery, or if they were born that way, you may see them needing to have a hydrolyzed formula that has a little bit smaller pieces in it so that they can get all of the nutrition that they need from their formulas. These formulas will also tend to prioritize amino acids and protein intake just for those patients that are really trying to heal, and we want them to be able to get enough protein to keep maintaining the lean muscle mass as well. For individuals who have any kinds of liver dysfunction or failure and they're being provided enteral nutrition, you may see the use of a hepatic formula. The hepatic formulas are typically made to be a little bit lower in sodium and fluid to help reduce ascites, as well as having a different composition in terms of amino acids, looking more heavily on branched chain amino acids, but lower in overall protein content. With these formulas, it can be pretty tricky to make sure that you're determining the right patient for them just because they are so specific. So make sure you use your best clinical judgment to make sure that your patients are getting all that they need, because sometimes they'll do better on a standard formula, sometimes they'll do better on a hepatic formula. So keep in mind that with the very specific formulas, you want to be pretty picky as to who you're providing those to and make sure that you're giving the best you possibly can to your patients. The last category that we'll talk about today is less of an enteral formula, more of an enteral feeding approach, and that's called a blenderized or whole food tube feed. The whole food tube feed has certainly gained a lot of traction in the past few years and is becoming more popular for patients who have a permanent or semi-permanent type of enteral feeding site that goes directly to the stomach. For the most part, these patients are going to be on a long-term approach for enteral feeds, and they're typically patients who are looking for more of a whole foods approach, which allows them to utilize actual foods that have been blended or processed to then be usable through their enteral site. This provides them with the opportunity to get additional phytochemicals and other good nutrients, fiber, deliciousness into their body without having to utilize an enteral formula that may have more synthetic options or may have products in it that they don't really like to utilize, such as more of the corn oils or maltodextrins, things like that, that some individuals on long-term tube feeds don't really want to use forever. I've not seen blenderized or whole food tube feeds utilized in a hospital ever, but probably more popular in an outpatient setting. But if you do see these, it's very important that you help your patients to understand proper food safety techniques, as well as only being able to hang the bags for about 2 hours, or even if you want to be safer in terms of food handling, you can just utilize exclusively bolus feeds in this sense. So definitely look out for blenderized and whole food tube feeds and read up more on them if you haven't heard about them before, because it's a really interesting topic that I certainly think you'll hear additional things about in the years to come. Well, that's all I have for you today in terms of our adult enteral nutrition formulas and what categories they may fall into. If you're still wondering what your formulary contains at your hospital or at your internship rotations, don't forget to take the formulary, look at this video, and sort them all out so you know kind of a baseline of what you might recommend for your future patients and what formulas you have at your disposal to use in your own practice. If you have any comments, questions, concerns, anything like that, please don't forget to leave them in the comments box below. And if you like what you see, don't forget to subscribe to our channel so you can see all of our new updates. Thanks so much, and we'll see you next time.